हेलो एवरीवन। आज हम सीखेंगे आशास के क्या क्या इंसेंटिव है। आशा मतलब एक्रेडिटेड सोशल हेल्थ एक्टिविस्ट, जो कि क्रिएट हुई थी अंडर नेशनल रूरल हेल्थ मिशन इन 2005 और एनएचएफ में कंटिन्यू हुआ था नेशनल हेल्थ मिशन में आशा। सो आशा इंसेंटिव बेस्ड है। सो ये लिस्ट है एनएचएसआरसी से अप्रैल 2024 का। सो हम डिस्कस करेंगे कि क्या क्या इंसेंटिव्स होते हैं आशा के। सो ये एसआर नंबर दिया हुआ है इधर एक्टिविटीज़ दे रखी है और उसका इंसेंटिव इन रुपीज़ दे रखा है पर केस। So let's begin our session. So first is mobilizing and attending village health nutrition day or urban health nutrition day. It is rupees 200 per session. Conveying and guiding monthly meetings of VHSNC, Village Health Sanitation Nutrition Committee and Mahila Arogya Samiti. It is rupees 150. Attending monthly meeting at block PHC and UPHC, rupees 150 again. Line listing of households done at the beginning of the year and updated every 6 months, rupees 300. Maintaining village health register and supporting universal registration of births and deaths to be updated on monthly basis, it is rupees 300. Preparation of due list of children to be immunized on monthly basis, it is rupees 300. Preparation of list of ANC beneficiaries and preparation of list of eligible couples on monthly basis, it is rupees 300. Next is ASHA's incentive on the national health program. First is maternal health program. So Janani Suraksha Yojana financial package. So first is for ensuring antenatal care of the woman, rupees 300 for rural, 200 for urban. For facilitating institutional delivery, rupees 300 for rural and 200 for urban areas. Second is reporting death of women 15 to 49 year of age group by ASHA to PHC medical officer. It is rupees 200 within 24 hours of occurrence of death by phone. Third is mobilization of HRV, that is high risk pregnancies under EPMSME, Pradhan Mantri Surakshit Matritva Abhiyan. It is rupees 300 per ASHA to mobilize high risk pregnancy women to facility for follow up at rupees 100 per visit for maximum up to 3 visits. Fourth is health outcome of high risk pregnancies under EPMSME. It is rupees 500 after ensuring survival of baby and mother duo after 45 days of delivery. Fifth is identification of high risk pregnancies and their healthy outcome during postnatal period under optimization of PNC. It is rupees 250 after ensuring survival of baby and mother duo after 45 days of delivery. Next is child health. So first, home visits of the newborn and postpartum mother. It should be 6 visits in case of institutional delivery and 7 visits in case of home deliveries. It is rupees 250. Home visits for young child for strengthening of health and nutrition of young child through home visits. Recommended schedule is 3, 6, 9, 12 and 15 months. It will be rupees 50 per visit with total of rupees 250 per child for making 5 visits. Third is ensuring quarterly follow-up of low birth weight babies and newborn discharge after treatment from specialized newborn care units. It is rupees 50 per quarter from the 3rd month until 1 year of age. Fourth is child death review for reporting child death of children under 5 years of age. It is rupees 50. Now week 1 and week 2 ASHA incentive for prophylactic distribution of ORS to families under 5 children. It is rupees 1 per ORS packet for 100 under 5 children or rupees 100 per ASHA. Third is immunization, full immunization of child under 1 year. It is rupees 100. Then complete immunization per child up to 2 years of age. It is rupees 75. Mobilization of children for OPV oral polio vaccine immunization under pulse polio program. It is rupees 100 per day. DPT booster at 5 to 6 years of age, rupees 50. Mobilization of children for routine immunization, rupees 150 per session. Next is family planning, ensuring the spacing of 2 years after the marriage, rupees 500. Spacing of 3 years after the birth of first child, rupees 500 again. Ensuring a couple to opt for permanent limiting method after 2 children, it is rupees 1000. Counseling, motivating and follow-up of cases for tubectomy, it is rupees 200 in 11 states with high fertility rates and rupees 300 in 146 Mission Parivar districts and rupees 150 in remaining states. Now fifth is counseling, motivation and follow-up of cases of vasectomy. It is rupees 300 in 11 states with high fertility rates and 400 in 146 Mission Parivar Vikas districts and rupees 200 in remaining states. And female postpartum sterilization, rupees 300 in 11 states with high fertility rates and rupees 400 in 146 MPV districts. Now escorting or facilitating beneficiaries to health facility for PP-IUCD insertions, it is rupees 150 per case, and for PA-IUCD insertion, rupees 150 per case. Now Mission Parivar Vikas, it is extended in all districts of the 7 high focus states, that is UP, Bihar, Jharkhand, MP, Chhattisgarh, Rajasthan and Assam, as well as 6 northeastern states of the country. So under this injectable contraceptives MPA, that is Antara program, and non-hormonal weekly sent Croman pill Chaya incentive to ASHA given is rupees 100 per dose. Then Mission Parivar Vikas campaign block level activities, ASHA to be oriented on eligible couple survey for estimation of beneficiaries and will be expected to conduct eligible survey. So maximum 4 rounds she has to conduct. It will be 150 per round per ASHA. And नई पहल family planning kit to the newlyweds will be distributed by the ASHA. So it will get 100 per ASHA per नई पहल kit distribution. And सास बहू सम्मेलन to mobilize सास बहू for सम्मेलन, so maximum 4 rounds, so 100 per meeting she will get. Now next is adolescent health. So distributing sanitary napkins to adolescent girls, ₹1 per pack of 6 sanitary napkins. Organizing monthly meetings with adolescent girl pertaining to menstrual hygiene, she will get ₹50 per meeting. Incentive for support to peer educator, it will be ₹100 per peer educator. And incentive for mobilizing adolescents for adolescent health day, it will be ₹200 per adolescent health day. Now participatory learning and action, PLA. So she'll conduct a PLA meeting, 2 meeting per month she has to conduct. So she'll get ₹100 per ASHA per meeting for 2 meetings in a month. Next is nutrition. So referral of SAM children to NRC, Nutritional Rehabilitation Center, and follow-up of SAM children after discharge from NRC. So she will get a total amount of ₹300, 100 for the referral and 200 for the follow-up. For mobilizing and ensuring every child 1 to 19 years out of school and non-enrolled is administered albendazole, it shall get ₹100 per ASHA biannually. Mother's Absolute Affection Ma program for promoting the breastfeeding, a quarterly mother meeting she has to conduct, she'll get ₹100 per ASHA per quarterly meeting. Now under Anemia Mukta Bharat, she'll get incentive for maintaining the compliance and mobilizing children for IFA for 6 to 59 months of children, she'll get ₹100 per month per ASHA. ASHA's incentive for mobilizing, ensuring IFA for WRA, it will be ₹50 per month per ASHA. Now next is National Tuberculosis Elimination Program, NTP. So she'll get honorarium to treatment support to be dispersed upon completion and cure of TB patient. For drug susceptibility TB patient, she'll get ₹1,000. For treatment support to drug resistant TB patient, she'll get ₹5,000, 2,000 for IP and 3,000 for continuous fees. Incentives to informant for notification, they'll get ₹500 for referral of presumptive TB patient to public health facility and diagnosis as TB. Now incentive to ASHA or community volunteers for ensuring the bank account, seeding of the bank account, details of the TB patients in Nikshay portal. It has to be done within 15 days of treatment initiation. For enabling DBT payments under NTEP, she'll get ₹50 per notified TB patient for seeding of bank account details on the Nikshay portal. Now fifth is incentive to ASHA, community health volunteers, for supporting treatment adherence and completion of TB preventive treatment among eligible individuals. She'll get ₹250 per individual for successful completion of TB preventive treatment. Now seventh is mobilization of beneficiaries through ASHA or other mobilizers for additional adult BCG beneficiaries. It will be ₹150 per session. So 2 mobilizers will be present at each session site, ASHA, Anganwadi worker or link worker. Each mobilizer will be paid ₹75 with a maximum limit of ₹150 per session per site. Now 8th is ASHA's incentive for preparation of due list for monthly updating of due list of beneficiaries for adult BCG vaccination. She'll get ₹300 per month into 3 months if mop-up is required. So this amount will be paid to ASHA. If no ASHA is identified or available, the same will be paid to link worker or Anganwadi worker subject to total ceiling of ₹300. ASHA's incentive for house-to-house survey before the campaign begins, it will be ₹300 once for the campaign. This amount will be paid to ASHA. If no ASHA is identified, again the link workers or Anganwadi workers will be paid the money. Now next is National Leprosy Eradication Program, NLEP. So referral and ensuring compliance for complete treatment in possibacillary cases, she will get ₹250 per case for early detection. For late detection, 200 per case, and ₹400 per case for possibacillary case treatment completion. Now for completion of in multibacillary cases of leprosy for 33 states, she will get ₹250 per case, ₹200 per case for late detection, and ₹600 per case for multibacillary case treatment completion. Now ASHA's incentive for leprosy case detection campaign, LCDC, search activity incentive for ASHA under this is ₹75 per day for 14 days. So total amount of ₹1,050 for 14 days will be paid to ASHA under National Leprosy Case Detection Campaign, LCDC. If it is done twice, then she will be paid twice. Next is National Vector-Borne Disease Control Program, so National Malaria Control Program. So preparing of blood slides or testing through RDT, she'll get ₹15 per slide or test. And providing complete treatment for RDT positive P. falciparum cases, she'll get ₹200 per case. Providing complete radical treatment to positive PF and PV cases, again she'll get ₹200 for confirmed cases. Now for referring a case and ensuring complete treatment, she'll get ₹300. Next is lymphatic filariasis. For one timeline listing of lymphedema and hydrocele cases in all areas of non-endemic and endemic district, she'll get ₹200. For annual mass drug administration for cases of lymphatic filariasis, she'll get ₹200 per day for maximum of 3 days to cover 50 houses. That is 250 person. Now, AES, acute encephalitis syndrome, and Japanese encephalitis cases to the nearest, if she refers the cases to nearest CHC, district hospital and medical college, she'll get rupees 300 per case. Next is Kala Ajar elimination. So involvement of ASHA during the sprayer rounds, IRS, for sensitizing the community to accept indoor spraying. She'll get rupees 100 per round during IRS sprays and rupees 200 in total for 2 rounds. Now ASHA's incentive for referring a suspected case and ensuring complete treatment, she'll get rupees 500 per notified case. And incentive to ASHA for referring post Kala Ajar dermal leishmaniasis PKDL case, she'll get rupees 500 per case. That is rupees 200 at the time of diagnosis and rupees 300 after the treatment. Now, dengue and chikungunya, incentive for source reduction, the source reduction activities and IEC activities for prevention control of dengue and chikungunya in all states. She'll get rupees 200. That is 1 rupee per house for maximum of 200 hours per month. Now, National Iodine Deficiency Disorder Control Program, ASHA's incentive for salt testing, it will be rupees 25 a month for testing 50 salt samples. Now, next is incentives under Comprehensive Primary Health Care, CPHC, and Universal NCD screening. So, maintaining data validation and collection of additional information as per completed form per family for the NHPM under Ayushman Bharat, she'll get rupees 5 per form per family. Now, filling up of feedback form, a community-based assessment checklist form for every individual. So, it is a one-time activity for enumeration of all individual. So, filling feedback for all individual 30 or above 30 years of age, she'll get rupees 10 per form per individual as one-time incentive. Now, follow-up of patients diagnosed with hypertension, diabetes, and 3 common cancer for initiation of treatment and ensuring compliance, she'll get rupees 50 per case biannually. And delivery of new service packages under CPHC component, she'll get rupees 1000 per ASHA per PM linked with activities. Now, drinking water and sanitation, so motivating households to construct toilet and promote the use of toilets, she'll get rupees 75 per household. Motivating households to take individual tap connections, she'll get rupees 75 per household. Now, ASHA certification, so it is an incentive award in cash for ASHAs and ASHA facilitators who have certified in 2 independent certificates, that is RMN CHA plus N and expanded service package from NCDs to palliative care. She'll get rupees 5,000 for all ASHAs and ASHA facilitators who successfully receive certification by NIOS in 2 independent certificates, that is an RMN CHA plus N and expanded package of new services from NCDs to palliative care. So total incentive will be rupees 5,000 into 2, that is rupees 10,000. It is introduced in year 2022. Now, facilitating and creating and seeding of ABHA ID, Ayushman Bharat IDs in various IT portals. It will be incentive for ASHA for each ABHA account created and seeding in various IT portal of MOHFW. She'll get rupees 10 for each ASHAs for each ABHA account created. It was also introduced in 2022. So this is a list for ASHA's incentive for April 2024. I hope you learned it. Thank you, guys.